my due date is nearing, my heart rate is increasing whenever I think about how I will manage labor contractions. Is this one worry that you are facing during pregnancy? Let us discuss all about labor contractions and how to time them in this video. Hi, I am Saranya, the founder of Babypedia, a birth professional and a life coach for pregnant women. And let me start by telling you one thing. All the delivery scenes that you see in movies, be it Hindi, Tamil, Telugu, Kannada, whatever it is all overhyped. No, you will not be made to lie down on a stretcher screaming when they take you to the labor room. No. Your pain, your discomfort, your contractions are not going to be continuous. Only one movie, as far as I know, has depicted labor beautifully, and that is the Tamil movie Ennai Arindal, in which Trisha manages an auto ride during her contractions. She steps out of the auto, she sits on a wheelchair, even though that may not have been needed at that point. She talks to the auto driver and pays him before she goes in to birth her baby. Yes, it can happen. You don't have to panic the minute you get contractions. Let me tell you why. Because when labor starts, your contractions are not going to be continuous. You will get a lot of break in between your contractions where you can rest, you can recover, you can feel normal. When your labor starts, your contractions are going to be very short in length. 20 seconds, 25 seconds, sometimes even 15 seconds. And the discomfort is going to be very mild initially. And after the contraction gets over, you may get a gap of anywhere between 20 minutes to even an hour or more between contractions, where you will feel nothing but normal. And then after that, again, another contraction, a gap, a contraction, a gap. So this is how it will go. Even in the pushing stage towards the end of labor, the maximum length of your contraction will be 2 minutes, 1.5 to 2 minutes, and you will get a couple of minutes gap in the middle. Your uterus is a muscle, so it will contract and then it will relax and it will rest. Again, your uterus needs to get the signal from your brain through a hormone called oxytocin for it to contract again. Initially, that will take time. So yes, you can walk, you can eat, you can chat, you can watch movies, you can listen to music, you can fight with your husband in between your contractions. That is why many times when you walk into the hospital at the starting of labor with mild contractions, your doctor may ask you to go back home and come when your contractions have picked up. Because you can definitely manage them at home. So don't worry, don't panic. It's not going to be continuous. You won't be lying in the stretcher screaming, screaming, screaming till you push your baby out. No. You get a lot of gap. Only 20% of the time you're in labor, you will have contractions. The remaining 80% you will have time to rest and relax. I hope this particular part of the video has cleared up a lot of your fear regarding labor. So let's discuss about timing your contractions after this. How do you time your contractions? Once you go into labor, then the first thing you will have to do is notice the starting point of a contraction. Use the timer on your phone or a watch or any app that has a seconds also, because most of your contractions will be in seconds. So it is best to record in seconds. So let's say your first contraction starts at 3 o'clock and let's say sharp 3 o'clock. Okay. And then this contraction is quite short. It ends at 3 o'clock, 20 seconds. So now the length of your contraction is 20 seconds. Then after another 20-30 minutes, the next contraction starts. So the next contraction starts at, let's say, 3 o'clock, 20 minutes, 3:20 a.m. or p.m. And it again lasts for 20 seconds. So 3:20, 20 seconds, and it's over. So the length of this contraction is also 20. So this is how you measure the length of your contraction. Now you have to measure another thing that is called the frequency of your contractions. What is this frequency? It is the gap between one contraction and the other. So you will need to know the length and the frequency. How to measure the frequency? Take the beginning of the previous contraction. So the first contraction was at 3 o'clock, right? And the second contraction was at 3:20. So now the difference is 20 minutes. You have to measure from the beginning of the previous contraction to the beginning of this contraction to know the frequency. So now that you are noting the length and the frequency, slowly as your labor progresses, you will start to see that the frequency is reducing. The length is becoming a little longer and longer. So when you go to the hospital and your doctor asks you, what is the length of your contraction? What is the frequency of your contraction? You have your answer right there. But do you need to keep checking and recording and noting it down throughout your labor? No. Do it whenever you feel a change in pattern. You feel like the contractions have become, closer together, more intense. Then you can measure, 4 to 5 contractions and see how you are going. You can stop after that. You don't have to keep measuring and noting down each and every contraction that you are going through. So if you found this video useful, don't forget to like, share it with somebody else who would benefit from watching this video, and subscribe for much more useful information. Take care. This is Saranya.